The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. The show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join. Hit me.
Welcome to the Senior Rehab Podcast.
The podcast for rehab clinicians that want to better serve older adults. Shorts. This is Senior Rehab Shorts, the evidence-based segment for geriatric rehab clinicians, bringing you relevant and applicable content to better serve your patients, regardless of your setting. And now your host, Joe Daniels.
Hello, friends, and welcome to another episode of Shorts. I'm really excited to talk to you guys this week a little bit more about residency and fellowship, and I found a great blog post from the APTA with regards to residency and fellowship awareness. And so it was, or is, a three-part blog series where in part one of the blog series, they talked about the what, so defining what residency and fellowships are and why or why not to choose this route post-graduation. Now in part two, which is what I'd like to cover today, they talk to graduates of residency and fellowship programs to find out why they chose this professional path, why they chose their specific residency, and how it benefited them both professionally and personally. So the APTA interviewed quite a handful of folks from a variety of specialties, but I just picked out a couple from geriatric residency programs, and having met both of these people and interviewed with both programs personally, I was really excited to hear about their sales pitch on why residency is so great. And so first is Dr. Rob Robinson, who completed the Brooks Institute of Higher Learning Geriatric Physical Therapy residency. He had this to say about residency and why he chose Brooks Rehab. So he says, I felt residency would open doors, particularly those in patient care, in management, as well as in education. I chose the Brooks Geriatric Physical Therapy residency because I knew I wanted to be part of an organization that was leading the way in evidence-based therapeutic intervention, continuing education, and community involvement. I also had the opportunity to meet previous residents and fellows, and it was consistently clear through interacting with them that they were passionate, knowledgeable, and highly motivated to share the skills that they had acquired by going through the program. I left each interaction with the clinicians with a sense that this was the type of clinician I wanted to become. Finally, I spoke with the residency coordinator and recognized immediately that she was passionate about not only aging our adult population, but also about developing strong clinicians. It was clear that was where I needed to be. While going through the residency, you further develop the clinical knowledge. This is a large benefit because you are a practicing clinician and can incorporate what you learn immediately into practice, unlike when you are in physical therapy school. One of the greatest benefits is the ability to clinically problem solve and develop a clear, high-level clinical thought process established primarily through direct clinical mentoring during patient care. Continuing to develop clinical decision-making by having that network of fellow residency grad allows you to challenge each other and hold each other accountable to progress yourself to the next level. It definitely prepared me to sit for the board certification, and I passed the geriatric certification exam on the first attempt. While it involves a significant commitment in terms of time and effort, I believe it's something that continues to pay daily dividends. The clinical decision-making and problem-solving skills developed through mentoring are used in working with patients, mentoring colleagues, and guiding students in the classroom. Be ready to learn how to take the constructive criticism, apply it, and keep yourself open to understanding different approaches. You can grow so much in such a short period of time and develop a strong clinical decision-making process that allows you to confidently practice at a very high level and be very patient-focused. I also think it's important for anyone considering residency to identify what's important to you. Are you looking for strong clinical mentoring? Are you looking for a strong emphasis on manual therapy? It's important to speak with and have an open conversation with those within the program that you're considering to make sure that it's the right fit for you. At the end of the day, you have to align your goals and values with those of the program and make sure that they are pointed in the same direction. I feel like if you do that, you're setting yourself up for success. So some great stuff from Rob there. Second person here is Dr. Erin Boyle, a board-certified clinical specialist in geriatric physical therapy who completed a geriatric residency program with the UPMC Centers for Rehab Services, and that's in Pittsburgh, who I also interviewed with, and she had this to say about UPMC and her residency experience. She says, I chose the University of Pittsburgh Medical Center for Rehab Services residency for a few different reasons. The program encompassed each step a patient may encounter across the continuum of care. What I mean by that is in 15 months, I spent equal amounts of time in acute care, skilled nursing, acute rehab, and outpatient settings, along with multiple specialty practice observations in home health, in surgery, in amputee support groups, and through a movement disorder clinic, just to name a few. Another great part of this residency was the required 3 hours of mentoring a week with a different mentor who specialized in each setting that I practiced. Throughout my entire residency, I was surrounded by extremely intelligent mentors and coworkers who were always ready and willing to share their knowledge with me. Along with everything I've previously mentioned, I felt extremely prepared for the geriatric clinical specialist exam by the 15 months. I felt very prepared to treat any geriatric patient I came across and felt more confident with my treatment techniques. With that being said, if I had any questions, I had so many mentors that I wouldn't hesitate to ask a question from the relationships I had made throughout residency. If you're a current student and thinking about residency, I would highly suggest doing it straight after graduation. Although new professionals who aren't sure what they want to specialize in right away, they should take the time they need to find their niche and then apply to residencies. Specializing in one population is something you want to be at 100% sure about, so taking a few years to decide what is best for you will be to your benefit. Regardless, if you're a current student or a new professional, I would highly recommend completing a residency. It was truly a great experience, both personally and professionally. So thanks to Erin there for sharing her experience. And the APTA at the bottom of this blog has a little statement which I thought was pertinent and wanted to include. So it says, by reading through insight and advice from current and former graduates of residency and fellowship programs, we hope that you have a better understanding of what these programs entail and how they can benefit you in your career. In part 3 of this series, we'll discuss how to find the best program that fits you and your goals. So I'm excited for that one to come out. If it's not out already, I'll have to take a little look. Also, as always, if you have any questions for me about residency, I'm starting in about a month here up in Jacksonville. As always, feel free to reach out. But until next time, stay funky, my friends.
Hit me. Thank you for listening to the Senior Rehab Podcast. I appreciate your time. And if you enjoyed this episode, do me one favor. Share it with one other person that would benefit. Thank you. If you want to see the show notes or find more episodes, just go to seniorrehabproject.com. And until next time, my friends, do not forget to stay funky. The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. This show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join.